On a chilly fall afternoon in 2021, a woman named Ruth Jones pushed her grandson's stroller through the Boston Common, a beautiful city park in Boston, Massachusetts. Ruth beamed with pride as people leaned in to get a look at 8-week-old Tommy, who was cooing and gurgling in his stroller. This was one of Tommy's very first excursions outside of the house, and he was bundled up so much that he almost looked like a little burrito with big brown eyes, fascinated by the treetops overhead and all the new faces waving hello. Ruth walked them around the pond, marveling at all the autumn foliage in the park, then sat down on a bench across from her favorite people-watching spot, the vintage carousel with hand-painted wooden horses and zebras. She turned Tommy's stroller so he could see the flashing lights and hear the lively organ music, but after a moment, Tommy started to cry. And so Ruth turned Tommy around and tried to calm him down, but it was like nothing she could do could get the boy to stop crying. Ruth's daughter Emily had warned her that Tommy had been very irritable lately. So she picked Tommy up out of the stroller and cradled him to her chest, thinking that might calm him down. But he just continued to wail in her arms, almost like he was actually in pain. Ruth then tried to give Tommy a pacifier, something he normally liked, but he wouldn't take it. And if anything, it just seemed to make him even more upset. Ruth wondered if maybe he was hungry, but she didn't have a bottle with her, so she decided it was time to take Tommy home. Tommy cried the entire way back. By the time Ruth got him to her daughter's house, his voice was hoarse. Now, at this point, Ruth did feel very sorry for Tommy. She didn't know what was going on, and obviously he was very upset. But if she was being honest, all this persistent crying was actually now giving Ruth a bit of a headache. And so she carefully brought Tommy into the kitchen, and she put the kettle on the stove for tea, and then put Tommy's bottle in a warmer. And while the milk was warming, she set out a teacup, put a tea bag in, and also got some honey out. All the while, Tommy just continued to wail and cry on her shoulder. Once Tommy's bottle was warm, Ruth tried to give it to him, but he was so upset he wouldn't take it. And so now Ruth was sort of out of ideas and really didn't know how to calm Tommy down. And so she just began walking around the kitchen, patting her grandson on the back and, doing everything she could to be motherly, but Tommy just kept on wailing and wailing. And then Ruth remembered that her daughter and son-in-law had said something about giving Tommy something sweet when he had been really upset these past couple of weeks. But Ruth looked around the kitchen and couldn't find anything that fit the description and didn't feel comfortable just giving him something random. And so ultimately, Ruth just sort of walked around the kitchen as Tommy screamed for the next few hours until finally Ruth's daughter Emily came home and took Tommy from her. 6 days later, Ruth was at Tommy's pediatrician's office, holding the crying baby to her chest while trying to fill out a clipboard of check-in forms. Over the past week, Tommy's meltdowns had gotten longer, louder, and more frequent. Ruth and Emily were both worried that something was genuinely wrong with him, and so Emily had scheduled this doctor's appointment for Tommy. But today, Emily had to work, and so Ruth had taken the baby. When they finally got called back to the examination room, Tommy's crying only seemed to get worse. And so the pediatrician, upon seeing Tommy, sort of furrowed her brow as she began conducting a routine physical exam. And as she did, Ruth explained that these crying fits had been going on like this for a full week. The pediatrician nodded as she touched the right side of Tommy's abdomen. And as she did, Tommy wailed harder and louder than Ruth had ever heard. She jumped to her feet out of instinct, genuinely horrified by the noise coming from her grandson. But the pediatrician just shook her head and said not to worry. She now knew what the problem was. There was gas stuck in his tiny stomach. The pediatrician then showed Ruth some exercises to do on Tommy, and she literally began pedaling Tommy's legs and folding them up and down and rubbing his stomach to help him pass the gas. And as she did that, in demonstration for Ruth, it did seem like Tommy was calming down just a little bit. However, by the time Ruth and Tommy were back home again, Tommy was wailing all over again. And so Ruth carried him up to the nursery and ran him through all those exercises she had been shown on his changing table, and he did pass some gas and he did start to quiet down. And for a second, Ruth felt relieved, like they were onto something, that they had really figured out what was wrong here and they were slowly making it better. But the second she picked Tommy up again, he started to cry again. Ruth was at a loss. She just couldn't seem to keep him calm. She paced the hallway with him, and she also just stopped and rocked him back and forth. She carried him up and down the stairs. She sang lullabies, but nothing worked. A few hours later, when Emily got home from work, Ruth almost cried with relief. She handed Tommy off to Emily the moment her daughter stepped through the door. Ruth was obviously still very concerned for Tommy, but she also desperately needed a break from the constant crying. It had just gotten worse all afternoon. His screaming was relentless. And now, as she walked outside down towards her car, she could still hear him crying in the house. And as Ruth drove back to her home, all she could think about is what's going on with Tommy. Half an hour later, back at Emily's house, Emily sat in the nursery with Tommy trying to feed him. Downstairs, she could hear her husband Dave in the kitchen making dinner. And even though Emily was hungry, she knew she had to give Tommy his own dinner before she could eat. And that was proving much more difficult than usual. Now, Tommy had always been a fussy baby, but nothing like the last week. The only time Emily noticed her son seemed even remotely calmed down and happy was when he was nursing, or when they dabbed a trace of honey on his pacifier and actually got him to use it. And so Emily rocked Tommy, and finally he did latch on, and he began breastfeeding, and at that point he did sort of quiet down. Except as he was eating, Emily noticed that he was not latching onto her breast as firmly as he usually did. As the minutes went by, she noticed that he seemed to be drinking less and less milk too. She wondered if maybe it was just because he was so tired from all the crying. A minute later, he'd stopped drinking completely and was fast asleep. Emily thought that maybe he wasn't all that hungry, so she put him in his crib and joined Dave downstairs for dinner. The next morning, just before dawn, Emily was back in Tommy's nursery, back in the armchair she used for nursing, but Tommy was not latching. No matter what she did, she could not get him to begin to breastfeed. Not even in the weak way he'd done the night before. It was just like he wasn't doing it. She knew Tommy had to be hungry, but she had no idea how to get him to actually eat. At this point, Emily felt like Tommy's behavior was more than just typical baby fussiness. And so when her husband appeared in the doorway a moment later, she told him they had to go to the emergency room. A few hours later, Dr. Ann Brogdon walked down the hallway of her Boston area pediatric hospital. She could hear her new patient screaming from inside the small examination room. And when she walked inside, she saw the patient's parents, Emily and Dave, who told Dr. Brogdon that their son, Tommy, had basically been crying nonstop for days. Dr. Brogdon went straight to work. She knew that Emily and Dave were new parents, and so she really wanted to put them at ease, because Dr. Brogdon assumed this was just, child fussiness. So she gave Tommy a routine physical examination, checking his reflexes and taking his vitals. And as she gently poked and prodded him, she asked Emily about his medical history. And everything Emily said sounded typical and healthy. She told the doctor that she'd had a routine vaginal delivery after an equally normal pregnancy. Tommy had no known allergies, and he wasn't on any medications except for vitamin D supplements. He was also still wetting his diapers regularly, though his last bowel movement had been 2 days earlier. Tommy didn't have all of his immunizations just yet, so he was susceptible to pneumonia, influenza type B, and whooping cough, but Tommy's symptoms seemed more like a gastrointestinal problem than any of those diseases. And unfortunately, Dr. Brogdon's physical examination wasn't giving her any real clues either. And so she told Tommy's parents that she would just have to conduct a little bit more testing. An hour or so later, Dr. Brogdon looked at Tommy's test results on her tablet. Tommy had tested negative for a whole bunch of diseases, RSV, influenza types A and B, and even COVID. So his distress probably was not caused by a viral infection. Tommy's blood levels were also all normal, which ruled out other things like appendicitis, pancreatitis, liver disease, or some kind of obstruction in his digestive system. Dr. Brogdon's physical exam had also already ruled out the possibility of child abuse, and it was unlikely that a breastfeeding infant could have ingested poison. So what was going on here? Dr. Brogdon decided to ramp up her efforts. Something was obviously wrong with Tommy, and it couldn't just be a case of bad gas. So she ordered a urinalysis, an ultrasound of his abdomen, and an X-ray of his chest. She hoped one of those more advanced tests might finally solve the mystery around what was going on with Tommy. When Dr. Brogdon opened the door to Tommy's room an hour later, the sound of his wailing immediately filled the hallway. And inside the room, Emily was pacing back and forth with Tommy in her arms as his screams echoed off the walls. Emily and Dave looked utterly miserable, totally sleep-deprived and confused and nervous, and unfortunately, Dr. Brogdon didn't have anything really positive to say, which only made it that much harder to deliver the news. She still didn't know what was wrong with their son. His chest x-ray came back normal, his ultrasound and urinalysis were also normal, and yet he was still crying. Emily and Dave were heartbroken. They couldn't believe that nobody knew what to do here. But Dr. Brogdon promised them she was doing everything she could to help, and then she told Emily and Dave that she was going to admit Tommy to the hospital. Four hours later, one of the hospital's pediatricians, Dr. Christopher Reynolds, entered Tommy's hospital room. He'd read in the clinical notes that Tommy had been crying for days, so he was surprised to find that the room was actually silent when he walked in. Emily and Dave were inside the room sitting on the bed. Dave was holding Tommy, who was nearly asleep. After more than 6 hours of uninterrupted crying, it seemed like the little boy had finally tired himself out. Dr. Reynolds hoped that was a good sign. The doctor introduced himself and reached for the baby to do a physical exam. He'd already scanned Tommy's case file and knew that despite crying for days, Tommy was mentally alert. But when Dr. Reynolds took Tommy and fully woke him up and tried to get his attention, he noticed that Tommy did not seem to focus on him. At first, he wondered if maybe it was because the boy was just so sleepy, but the more he examined the child, the more he began to realize that Tommy seemed to have no energy at all, and his reflexes were quite slow. It was like his reactions were on a time delay. Dr. Reynolds knew Tommy had to be tired, but this was something else. Dr. Reynolds immediately ordered an MRI to see if there was something wrong with the child's internal organs. And fortunately, that scan showed no abnormalities, but it meant Dr. Reynolds had to order more testing to figure out what was actually going on here. He told Emily and Dave that he wanted to test Tommy's next stool sample. And in the meantime, he also wanted to perform a lumbar puncture or spinal tap just to make sure that Tommy was not suffering from an infection in his brain or spinal cord. The spinal tap procedure did not take very long, but Dr. Reynolds knew it was very difficult for Emily and Dave to watch. The doctor had placed Tommy in the fetal position on his side and then inserted a long needle into his spine to draw out the spinal fluid. And even though he had placed numbing cream on the injection site, Tommy's cries were still ear-splitting the instant the needle broke the skin. Thankfully, it was all over in just a few minutes. Once Dr. Reynolds had the spinal fluid sample, he sent it for testing right away. And this time, Dr. Reynolds did get a useful clue. The spinal fluid analysis showed an elevated protein count, which could mean Tommy's body was working overtime to fight off some kind of infection. But since they had already ruled out a lot of the more common infections, Dr. Reynolds was now worried that Tommy might have meningitis, or inflammation in the brain. Bacterial meningitis, especially in children, is extremely dangerous. It can cause long-term problems with seizures, brain damage. It can even be fatal. And so even though the doctor didn't know specifically what kind of infection the baby was fighting, what he did right away was just put Tommy on antibiotics to try to kill whatever bacteria was causing the infection. About an hour later, Dr. Reynolds checked in on Tommy to see if the antibiotics were kicking in. But as soon as he examined the little boy, he could see there was a big problem. Tommy was really struggling to breathe, and whenever he breathed in, it almost sounded like he was grunting. In fact, Tommy was fighting so hard for oxygen that Dr. Reynolds could see his ribcage straining against his skin with every breath. And there was a faint blue tint growing around Tommy's lips, which truly scared Dr. Reynolds, because that meant the baby was not getting enough oxygen. And so he immediately put Tommy on supplemental oxygen and instructed the nurses to rush him to the intensive care unit. Moments later, the hospital's pediatric critical care specialist, Dr. Cassandra Pierce, examined Tommy in the pediatric ICU while his parents, Emily and Dave, stood by at the foot of his hospital crib. Dr. Pierce thought Tommy's cry was more weak and pained, and in fact, it sounded more like a snore than a wail, like it was taking everything out of him just to make a sound. To Dr. Pierce, that was a sign of an airway obstruction. So she turned Tommy onto his back, and when she did, she noticed his eyelids were drooping and his head sort of bobbed strangely up and down on his neck. Dr. Pierce knew she had to act quickly, and so she called for an intubation kit, and right away a nurse came back with one. Then Dr. Pierce took the hollow tube and slid it down Tommy's throat past his vocal cords, all the while Tommy was jerking in discomfort trying to pull away. But once the tube was all the way in and Tommy stopped thrashing, Dr. Pierce hooked it up to a ventilator, a machine that would now breathe for Tommy, so his body could rest and get the oxygen it desperately needed. But even as the child's chest began to rise and fall in a steadier pattern, Dr. Pierce knew Tommy's lungs were still at risk to collapse. But just then, the heart rate monitor by Tommy's bedside began beeping. Tommy's heart began beating much faster than normal. Then another monitor began going off, signaling that Tommy's blood pressure was rising too. It was like his entire body was panicking, even though he was lying there quietly. Thinking fast, Dr. Pierce turned to the nurse and asked her to start Tommy on continuous infusions of opioids and drugs called benzodiazepines, which would hopefully get his body to relax and relieve his pain until she could figure out what was going on. Also, Dr. Reynolds administered Tommy a sedative and lower-dose painkiller. An hour later, Dr. Reynolds was leaning over Tommy, testing his reflexes, and they remained very weak. In fact, overall, Tommy was just growing weaker by the minute. Further analysis had been conducted on Tommy's spinal fluid, and it had come back negative for meningitis. On the one hand, Dr. Reynolds and the rest of the medical team were relieved that the boy did not have meningitis. But on the other hand, at this point, they still just didn't have a diagnosis for Tommy, which was making caring for him nearly impossible. It's like in some ways, just having a diagnosis, even a bad one, would sort of be an improvement. They'd at least have the ability to try to treat something. But without a diagnosis, they were just sort of left scratching their heads. Dr. Reynolds went back to Tommy's medical history and looked for anything that somebody might have missed. But there was nothing that stood out. The child had no neurological deficits, he had no swelling in his heart or lungs, there were no gastrointestinal issues or urinary issues. On paper, Tommy should be fine. And yet, he continued to get sicker. In fact, he was now developing something called hypotonia, or severe muscle weakness. Something was clearly slowly paralyzing Tommy. But when Dr. Reynolds reviewed Tommy's brain scan, it showed nothing abnormal, which meant that whatever was weakening his muscles probably wasn't affecting his brain or spinal cord. Now, Dr. Reynolds knew he could diagnose Tommy with something called spinal muscular atrophy, a degenerative motor neuron disease that weakens the muscles closest to the center of the body. That would explain Tommy's overall weakness, his drooping eyelids, and his inability to latch when his mother tried to breastfeed him. It was also one of the more common genetic disorders in young kids. But deep down, Dr. Reynolds knew that diagnosis did not explain all of Tommy's symptoms, including the high protein levels in Tommy's spinal cord fluid. Then he thought Tommy's high protein levels and growing muscle weakness could be a sign of Guillain-Barré syndrome, a condition caused when the immune system attacks the nervous system and weakens the muscles. But Dr. Reynolds knew that that syndrome was very rare in babies. Dr. Reynolds paced the hallway outside of Tommy's room, trying to think if there was anything he hadn't thought of or some question he hadn't asked. And then he realized there actually was one question he had not personally asked the parents yet. And so he dashed back down the hallway to Tommy's room, he went inside, and he asked Emily and Dave, who were at their son's bedside, what had they fed their son in the past few weeks? Now, keep in mind, Tommy was breastfed, and so the assumption was he only got milk. But Dr. Reynolds was wondering if maybe this child had eaten something other than milk. But Emily looked up at Dr. Reynolds and just told the doctor that, yeah, Tommy is breastfed, and he's only had her milk. Dr. Reynolds felt defeated. For a second, he felt like maybe he had just solved what Tommy's issues were. Maybe it was coming from eating something that was not his mother's milk. However, just then, Tommy's father, Dave, added that on occasion, when Tommy would not take his pacifier, they would sweeten it with a drop of honey. Suddenly, it all made sense, and Dr. Reynolds knew what was wrong with Tommy. But it was a terrible diagnosis, and there was no time to waste. Tommy needed emergency treatment right away, even before the diagnosis was confirmed. The second Dave had said they fed their baby honey on occasion, Dr. Reynolds realized that Tommy had something called botulism. Botulism is a rare but serious illness caused by a bacterial toxin that attacks the nervous system. As the disease progresses, it causes difficulty breathing, muscle paralysis, and sometimes even death. Adults can typically fight off botulism, but babies, like Tommy, are not capable of overcoming the bacteria that spreads it. About 90% of untreated infant botulism cases are fatal. While botulism is rare, the bacteria that causes it is not. In fact, it's found in many kitchens, often hiding in an unlikely place: honey. Honey is a natural sweetener, but it should never be given to babies under the age of 1 for this reason. Unfortunately, Dave and Emily didn't know this, and when they dipped Tommy's pacifier in honey to sweeten it, they had unknowingly made their baby very sick. Dr. Reynolds sent Tommy's stool sample out for testing, knowing that it would take 6 days for the results to come back. But he was so sure about the botulism diagnosis that he just started Tommy on a special antitoxin treatment right away. Over the next 10 days, Tommy slowly regained movement in his arms and legs, and his botulism diagnosis was confirmed. It would still take another 20 days or so before he was well enough to be discharged from the hospital, and then once he was discharged, he had to spend 8 more days at a rehab facility. However, at the end of it all, he would make a full recovery, and he is doing well today. On a muggy Saturday night on June 7, 1986, 29-year-old Kathy Lipscomb parked her car in front of an apartment complex in San Antonio, Texas, and reached into her purse for a tube of lipstick. Kathy tilted the rearview mirror toward her face and touched up her lips. And as she looked at her reflection and swept her platinum bangs to the side of her forehead, she almost didn't recognize herself. There was a glow on her face that she hadn't seen in a long time, not since she'd been a newlywed. These days, the happy parts of Kathy's marriage felt very far in the past. Over the last 8 years, she and her husband had had 2 children, who they both loved deeply. But Kathy had come to feel increasingly trapped in her life, until just about a month ago when she and her husband had finally agreed to separate. To Kathy, that decision felt like it gave her back her freedom, and she knew that who she was seeing now in the rearview mirror of her brand new car was a brand new woman. Kathy grabbed her purse from the passenger seat, got out of the car, and walked towards the large apartment building up ahead. And suddenly, she felt really nervous. But it was the good kind of nervous. She had butterflies in her stomach because she was on the way to spend the night with her new boyfriend, who she had fallen completely in love with. Kathy's soon-to-be ex-husband had the kids, and for at least a little while, Kathy could put all her worries out of her mind. So she walked up 2 flights of stairs to the 3rd floor of the building and then rang the doorbell of her boyfriend's apartment. Kathy heard footsteps drawing closer, and then the door opened up, and Kathy beamed at the man standing there. The man grabbed Kathy and kissed her, led her inside, and shut the door behind them. The next evening, Kathy's soon-to-be ex-husband, 30-year-old Air Force Master Sergeant Bill Lipscomb, buckled their 4-year-old son and 7-year-old daughter into the backseat of his car and began driving to the other side of town, where Kathy had just moved into her own apartment. Kathy was supposed to pick the kids up from Bill's house, but she hadn't shown up, and she wasn't answering her phone. So now, Bill was driving the kids to her. When they got to Kathy's building, Bill knocked on the front door of Kathy's unit, which was on the ground floor, and he and the kids waited there in silence. When she didn't answer the door, Bill knocked again. But still, there was no answer. He turned to his kids and tried to smile because he didn't want to upset them, but he knew this was actually really weird. Kathy was never even late picking up their kids, so the idea that she just would blow it off entirely and then also not be home made no sense. Bill told the kids to wait at the door, and then he walked back to his car. He got a notepad, a pen, and a roll of tape out of the glove box and walked back to the building. Bill wrote a note stating that he and the kids were there at 6:45 and would try again later. Then he stuck that note to Kathy's front door. Then he looked down at the kids and asked them if they wanted to write their mom a note too. The little girl nodded and took the pen from her dad and scribbled onto the pad, and Bill tore out the page and stuck that to the door as well. The note read in large block letters, "Mommy, we love you." A day later, at around 9:30 a.m. on Monday morning, a woman working at a university health clinic named Sarah Bowers had a question for Kathy Lipscomb, who was one of the nurses that she worked with. So Sarah walked over to Kathy's office. But when she stepped inside, it was empty, and Sarah saw that a bunch of pink "while you were out" memos had piled up on Kathy's desk. Sarah walked in and picked up one of the messages and read it. It was from Kathy's husband, Bill. He had called in an hour earlier looking for his wife. And this, coupled with the stack of other notes that were very similar, gave Sarah a bad feeling in the pit of her stomach. Because Kathy was one of the most reliable nurses in the clinic. Like, where had she gone? Why hadn't she called in? Sarah picked up the phone and dialed Kathy's apartment number. She knew it because she and Kathy were actually friends outside of work. But the call just rang without an answer, and Sarah eventually hung up and returned to her desk. But over the next hour, Sarah could barely focus because all she could think about was Kathy. She kept looking up at the clock on the wall, watching the minutes tick by, hoping to see her friend walk into the office with a totally reasonable explanation for why she was late. Or even without an explanation. It didn't matter, so long as Sarah knew Kathy was okay. By the time the clock struck 10 that morning and Kathy still had not shown up to work, Sarah could not stand it any longer. She got up and walked directly to the office of her and Kathy's boss, Dr. David Pearl. When Dr. Pearl saw Sarah standing at his door with a troubled look on her face, he asked her what was wrong. Sarah told him that Kathy was 2 hours late to work, and she was not answering her phone. And based on the notes on her desk that were piling up, her husband had also not heard from her either. At this, Dr. Pearl furrowed his brow. Kathy hadn't mentioned anything to him about being late or absent that day. It made him concerned that she might be sick, or maybe even injured, and couldn't get to the phone. So he asked Sarah to drive over to Kathy's apartment to check on her. Sarah sped over to Kathy's apartment, which was only about 10 minutes away. When she got there, she found the notes on the door and she knocked, but there was no answer. And so feeling kind of desperate, she ran to get the building manager and begged the woman to let her into her friend's apartment. Now, the manager knew this was against company policy to do this, but she could see how upset Sarah was, so she unlocked Kathy's door and let Sarah go inside. And what Sarah found inside sent her panic through the roof. The apartment was perfectly neat and tidy. It didn't look like anything bad had happened here, but there was no sign of Kathy. In fact, it looked like she had not been home for days. At around the same time, about 15 miles away, an airman who worked at the local Air Force Base was driving to work down a 2-lane road outside of town when he noticed something lying in the grass on the side of the road. The airman pulled over to the shoulder and got out of his car to investigate. He walked off the road and into the grass and stared down into the weeds in utter disbelief. When he got over the initial shock, he ran back to his car, drove to the nearest house, and called the police. It took police officers from the Bexar County Sheriff's Office just a few minutes to arrive at the spot on the road where the airman had made his discovery. It was a strange location for a 911 call. The area was pretty much deserted, and this road was basically only used by Air Force personnel who drove in and out of the base. The police got out of their cruiser and walked to the side of the road into some spiky grass, and just a few feet in, they stopped. For a minute, they just stood there together in silence, looking down. Because there, lying in the weeds below, they saw the dead body of what looked like a teenage girl. She was naked and covered with ants, and they saw thin trails of blood on the sides of her mouth. But as horrifying as all of that was, the officers were actually much more fixated on something else. The girl's body was contorted. Her legs were bent at the knee, and her ankles were crossed, as if she had been sitting crisscross style. Her torso had been folded forward, so her chest was resting on her legs, and there was some kind of fabric under her foot. The officers had been to enough crime scenes to know that this girl's body had not just been tossed out of a car quickly by a person trying to get rid of evidence. Instead, her body had been carefully posed, like whoever killed her wanted her to be found. That afternoon, homicide investigator Sergeant Sal Marin sat in his office at the sheriff's station trying to ID the victim that police had just found on the side of the road. Marin had started off pretty confident that he would be able to figure out who it was pretty quickly. From the looks of things, the victim appeared to be a teenager, and she had been healthy, well cared for, and well groomed. In other words, she looked like she probably had a family who would definitely report her missing right away. But so far, Marin had not been able to find any missing persons reports that matched her description, and he thought that was strange. Just then, a secretary came by and dropped off the medical examiner's report from the autopsy along with the crime scene report. Marin grabbed the medical examiner's report first, and as soon as he opened it, he grimaced. The victim had been sexually assaulted and strangled to death, most likely on Sunday night, so one day before she was found. Her body appeared to have been posed soon after her death, before rigor mortis had set in, which is the stiffening of the body after death. And to Marin, this felt off. Usually, when young women were murdered, the killer was someone they knew, either a partner, friend, or a family member who acted out of rage or jealousy. Sadly, it wasn't unusual to see sexual assault or strangulation in cases like this, but it was extremely unusual to see such deliberate posing of the body. Killers who know their victims often try to cover them up, not display them. Posing a body was evidence of a careful and deliberate killer, acting with a plan. It was something that sadists and serial killers did, and it made Marin think that his killer was likely a stranger to the victim. And that was bad news, because killings by strangers were among the hardest to solve. The suspect pool was enormous, because the killer could be anyone. But as Marin continued through the report, he spotted what he thought might be his first clue. 4 strands of long red hair that were found on the girl's body. The girl was a blonde, which meant the red hairs could have come from her killer. The medical examiner had examined these hairs under a microscope, and they found they had been dyed red and they had no roots. And Marin wasn't sure what to make of this. The hair could be from a wig, or they could be from a woman's head, but Marin found it highly unlikely that his killer was female. He put the autopsy report down and picked up the crime scene report, and here, Marin found his second clue. The victim's clothing, which was a pair of Levi's jeans and a t-shirt, had been placed underneath her right foot by the killer. And what Marin noticed was the clothing had been rolled up rather than folded. Marin picked up a pen and wrote down the word military in the margins. Marin knew that people in the military were trained to roll up their clothes instead of folding them, because it was more compact and efficient. And the girl's body had been found on a road used almost exclusively by members of the Air Force. But before Marin got too deep into his theories on the killer, his first priority was to find the dead girl's identity. Only then would he be able to begin retracing her last moments and figuring out who she had contact with in her final days. So, over the next hour, he began reaching out to local radio and TV stations, asking producers to broadcast news of the crime every half hour, with a description of the young victim. He got the story placement at the top of the afternoon news. Later, at 5 p.m., when still no tips had come in, Marin was getting ready to leave and grab something to eat, but just as he was standing up from his desk, his office door swung open and a deputy handed him a single piece of paper. It was a missing persons report for a woman named Kathy Lipscomb. Her family had just called to report that no one had seen or heard from her since Saturday. And the second Marin started reading the report, he felt a rush of adrenaline. Kathy was petite, blonde, and had gone missing right around the time the medical examiner believed his victim had been killed. Marin thought Kathy might be his victim. But then his eyes settled on Kathy's age, and he felt his excitement drain away. Kathy was 29 years old, almost 30, but the dead woman found on the side of the road looked a full decade younger than that, at least, so Kathy didn't seem to be a match for his homicide victim. Still, Marin wondered if this missing persons report about Kathy Lipscomb was a different kind of clue in his case, because based on Kathy's physical description, it was eerie how similar the two women were. Marin felt his appetite vanish, and he sat back down at his desk. He was starting to fear that he could have a serial killer on his hands, who was hunting petite blonde women, and that Kathy could actually be his second victim. A few hours later, Sergeant Marin's efforts to get the description of his victim blasted out onto the airwaves paid off. By this point, Marin was at home on his couch watching TV when his phone rang. He walked into the kitchen and picked it up. It was the medical examiner's office calling to tell him that a woman watching the news had heard about the discovery of the body and realized that the description of the young victim matched a friend of hers perfectly. At first, this woman had not wanted to believe it, so she actually had gone to her friend's apartment to check on her. But when her friend did not answer the door, the woman had called the police. And the police directed this woman to the medical examiner's office, where she would positively identify the body. Marin's victim finally had a name. When Marin heard the name, he immediately turned to the coffee maker on his counter and started brewing a pot. He was going to have to go straight back to work. Because Marin did not have two victims on his hands, he had just one. The dead body of the girl by the side of the road and the missing Kathy Lipscomb were one and the same. Kathy, despite being 29 years old, was just unusually young-looking. This meant that Marin's theory of the case, that he might be dealing with a serial killer, had become a bit more unlikely. He still viewed the posing of the body as evidence that the killer was a stranger to the victim, acting on a calculated plan rather than a sudden burst of emotion. But he was down to just one victim. And now that his victim did have an identity, Marin had to do the part of his job that he hated the most. And that was to tell his victim's family about the murder. About an hour later, Marin met Kathy's husband, Bill Lipscomb, at the sheriff's station. Marin was aware that Bill was a decorated member of the Air Force, and that he was very young to be a master sergeant, which was a pretty high rank. So Marin knew that the smartest way to approach Bill was to be formal and polite, rather than aggressive, even though divorce was a classic motive for murder, and Bill was a natural suspect. So, in the interview room, Marin reached out and shook Bill's hand and told him he was very sorry about his wife. He promised to do everything he could to bring her killer to justice. But while Marin was giving Bill his condolences, he was also looking Bill over very carefully, visually checking his arms, his hands, and his face for any signs of injury, like bruises, scratches, or fingernail marks that might be evidence of a recent struggle. But, except for the fact that Bill was pale and sweating, he appeared to be physically unharmed. Marin opened up his notepad and asked Bill where he was over the weekend when Kathy had gone missing. Bill said he had been with his and Kathy's children since Friday afternoon. He said they didn't do much, just kind of hung around the house. Bill said Marin could talk to the kids, and they would tell him the same thing. Marin nodded, and then asked Bill how long Kathy had been living in her new apartment. When Bill sighed at the question, Marin looked up from his pad. He was surprised to see that Bill almost looked angry. Bill shook his head and told Marin that Kathy had only been in the new place for about a week or so, but the neighborhood it was in had been a point of contention between them. He said he'd warned Kathy it was a bad area. He didn't like the seedy bars and strip joints all over the place, but Kathy had refused to listen to him. The apartment was close to her work, and she told him it was not his business anyway. Bill shook his head again and looked down at the table, and Marin could tell that clearly the separation between Bill and Kathy was still pretty raw. He told Bill he had just one more question, and then he'd let Bill go home to his kids. Marin explained to Bill that based on the location where Kathy's body was found, and the way her clothes were rolled up, not folded, he thought there could be a military connection. He asked Bill if any of his fellow airmen might have had a problem with Kathy, or if one of Bill's subordinates could have been angry at him. And with this question, Bill went from looking upset at Kathy to looking upset at Marin. He said no, absolutely not. His friends at the Air Force all loved Kathy, and he got along great with the people he worked with, regardless of rank. He didn't have any enemies, and no one he knew could have done anything like this. Marin sat back studying Bill. He could tell Bill was worn out and getting frustrated, but he didn't find that particularly suspicious, given the circumstances. Marin decided that the best move was just to tell Bill to go home. It was late, and he'd get better interviews in the morning. The next morning, Sergeant Marin interviewed Bill and Kathy's two young kids, and they confirmed their father's story. They had been with their dad all weekend, just like he'd said. So Marin decided he had to start from square one. First, he decided to interview Kathy's neighbors to see if anyone had spotted a person lurking outside her apartment. If the killer was a stranger to Kathy, like Marin suspected, then they would likely have found her by simply running into her somewhere, and it was possible they might have followed her home. And right away, when he started to canvass, he got a tip, and a surprise. Because one of Kathy's neighbors told him that on the day Kathy's body was found, he saw a suspicious person walk up to Kathy's door and then just lurk there for a few minutes before walking away. And the neighbor said this person was a woman, not a man, which was not what Marin was expecting. When he asked the neighbor for a physical description of this woman, the neighbor paused and thought for a second, saying he hadn't gotten a very good look. But then his eyes lit up as he remembered one crucial detail. The suspicious woman had long, red hair, just like the 4 strands of long red hair the medical examiner had found on the victim's body. Sergeant Marin spent the next couple of days talking to Kathy's family, friends, and coworkers, probing for any information about a red-haired woman in Kathy's orbit. But not one single person had any idea who that could be. Instead, Kathy's friends and family had a different idea for a suspect: Kathy's new boyfriend. Kathy had only been dating this man for a few weeks, but she was already saying she was madly in love with him. But some of her friends thought the boyfriend was bad news. The first reason for this was because he was married. The boyfriend kept telling Kathy that he and his wife were separating and would be divorced soon, and although Kathy believed him, none of her friends did. This boyfriend also had a reputation for sleeping around and promising every woman he was with that he was going to leave his wife for them. In fact, he was known for keeping a bachelor pad apartment where he could entertain his various girlfriends without his wife's knowledge. And another reason Kathy's friends didn't like her boyfriend was even simpler. It was because he was her boss. Kathy's boyfriend's name was Dr. David Pearl. It was Dr. Pearl who, on the Monday that Kathy failed to show up for work, sent her coworker Sarah to Kathy's house to check on her. Kathy's friends knew she had been spending time with Dr. Pearl when she didn't have the kids with her, and that caught Marin's attention, because the kids had been with their father on Saturday night, which, as far as police knew, was the last time anyone had seen Kathy alive. Marin wanted to know if Kathy had gone to meet Dr. Pearl that night. And so, a few days into his investigation, Marin found himself putting the red-haired woman on the back burner for a new number 1 suspect: Kathy's boss and boyfriend, Dr. Pearl. Almost a week after Kathy was murdered, Marin sat at his desk in police headquarters, making a list of possible scenarios while he waited for uniformed officers to bring Dr. Pearl in to be interviewed. He thought maybe Kathy had been pushing Dr. Pearl to get a divorce. Maybe Kathy threatened to tell his wife. Or maybe, Marin thought, the doctor's wife had already found out about the affair and taken revenge on Kathy. Marin sat back at his desk and wondered if the suspicious red-haired woman who had been seen at Kathy's apartment the day her body was found could be Dr. Pearl's wife. Just then, a uniformed officer knocked on Marin's door to tell him that Dr. Pearl was waiting for him. Marin stood up and followed the officer back to the little interview room where Dr. Pearl was sitting, looking perfectly calm and in control. When Marin walked in, Dr. Pearl immediately reached out and shook his hand. And then before Marin could ask even one question, the doctor began telling him how shocked he was by Kathy's death. The doctor said it just didn't make any sense, because he had just seen Kathy a day or two before she died, and she had seemed totally fine. Marin nodded, being careful to keep his facial expression neutral. When Dr. Pearl was done saying how sorry he was for Kathy, Marin looked down at his pad and asked, in a very deliberate voice, where and when exactly had the doctor last seen Kathy. And at this, the doctor went silent. Marin knew it was clear from his tone that he already knew where and when Dr. Pearl had last seen Kathy, like he knew about the affair, and it was obvious. But what Marin was doing with this question was testing how this very smooth suspect reacted to a little bit of pressure. Dr. Pearl stared at Marin for a few seconds with a polite but completely blank expression on his face, and after a tense moment, the doctor gave an apologetic smile and said, "I'm sorry, but I'm going to need to speak to my lawyer." On Saturday, June 15th, so a week after Kathy had been murdered, Marin was at home, taking a day off to try to clear his head. This case had felt like trying to put together pieces from 3 different puzzles into one coherent picture. None of the clues made sense together. The posing of the body suggested a methodical killer who did not know the victim. But Marin's best suspect was Kathy's boyfriend. The rolled-up clothes suggested the killer had a military background, and Kathy's soon-to-be ex-husband was a member of the Air Force, but he had a rock-solid alibi, and none of his friends or colleagues had any real link to Kathy. The sexual assault suggested that the killer was a man, but the long red hairs on the body and the suspicious red-haired woman at Kathy's door were evidence that there was a female involved. And beyond all these contradictions, there was very little in the way of actual physical evidence to tie any suspect at all to the murder scene. So when Dr. Pearl had lawyered up during his interview, Marin had had no choice but to let him walk out of police headquarters without charging him. And since then, the only thing he'd learned was that Dr. Pearl's wife did not have red hair and had never been to Kathy's apartment. Just then, Marin heard his phone ring and he hopped up. He hoped it was someone calling to tell him there had been a new break in the case, just like the last time he got a call at home. But when he answered, it was just more bad news. A crime scene tech told him that Kathy's car had been found in the parking lot of a restaurant a mile from her apartment. Forensic investigators had searched it for fingerprints, but they came up empty. Someone had wiped it clean. Over the next few weeks, every lead Marin tried to chase went nowhere. And slowly, newer homicide cases started to pile up, and they began to take up more and more of Marin's time. Marin did return to Kathy's case every few weeks, hoping he'd spot something he missed. But no matter how many times he read the different reports, nothing in them made any more sense than it had in the beginning. A month or two into the investigation, Kathy's mother had called Marin, and he promised her he would make sure that Kathy's murder was not forgotten. But as the months piled up, the case just got colder. By the 1-year anniversary of Kathy's death, the only thing Marin knew for sure was that whoever killed Kathy had not killed again, at least not in the area of Bexar County. There had been no other murders reported, with the posing of the body, or the long red hairs, or the rolled-up clothing. By the 2-year anniversary of Kathy's death, Marin had begun to dread the calls from Kathy's family, because the only thing he had to offer them were apologies. It was not until late 1988, so more than 2 years after Kathy was murdered, that all the blurry pieces of evidence finally snapped into focus. And it happened because Kathy's family hired a private investigator. When this PI heard about the initial handling of the case and the huge mistake made in thinking that the body of Kathy Lipscomb was that of a teenage girl, he decided to start the investigation all over again. And in doing so, he discovered a critical piece of evidence that somehow the police had missed. That evidence was Kathy's datebook. In this datebook, Kathy had written cryptic notes about something called the WAPS test. The PI didn't know what a WAPS test was, but apparently, someone Kathy knew had all the answers to this test and was passing them around. To the PI, this sounded like Kathy knew something about some kind of cheating scandal. Not like adultery, like actual cheating on a test. But the PI wondered who in Kathy's orbit would be taking a standardized test. It didn't make sense for anyone at Kathy's job, which was at a medical office. On a hunch, the PI called the nearby Air Force Base, and that's when he realized he was holding the link that completed the chain of evidence, and broke the case wide open. Now, the PI worked with the Air Force as well as Sergeant Marin to bring in a man who had, until the discovery of the datebook, flown completely under the radar. His name was Clint Richards, and he had worked with Kathy's soon-to-be ex-husband, Bill Lipscomb, in the Air Force. And when investigators brought Clint in to talk, he told them everything. Based on Clint's story and evidence gathered throughout the investigation, the following is a reconstruction of what police believe happened to Kathy Lipscomb on the night of June 8, 1986. That night, the killer sat patiently inside of their home on their couch, waiting for Kathy to arrive. They'd been expecting her. And when the killer heard knocking, they walked across the room, put a smile on their face, and opened their front door. There was Kathy, exactly on time as usual. The killer gestured for her to come inside, and she stepped over the threshold while the killer shut the door behind her. As soon as Kathy looked around the room, she realized something was wrong. It was too quiet. But the killer was expecting this. When Kathy turned to confront them, the killer pushed her to the ground and raped her. Then they grabbed an electrical cord they had hidden nearby, climbed on top of Kathy, and wrapped it around her neck. As they pulled, Kathy tried to fight back, but after several minutes, it was too much and she stopped moving. After Kathy was dead, the killer stood up, crossed the room, and opened a cedar chest. Then they dragged Kathy's limp body across the floor, they folded her at the waist, picked her up, and jammed her inside of the chest, crossing her legs so she'd fit. Once the chest was closed, the killer called a friend. A few hours later, the killer and the friend carried the cedar chest with Kathy's body inside out of the killer's apartment and loaded it into the friend's vehicle. Then, the killer handed the friend 4 strands of long red hair and walked back inside of their house. The friend drove off with Kathy's body and the hair. After a few minutes, the friend turned their car onto a deserted 2-lane road outside of town. They pulled over, removed Kathy's body from the chest, and carefully placed her on the ground on the shoulder of the road. Then, the friends set about staging the scene to look as if the killer had posed Kathy's body on purpose. They rolled up Kathy's clothing and placed it underneath her right foot, and then they laid the 4 long red hairs on top of Kathy's body. Finally, when the scene was perfect, the friend got back into their car and drove home. With Kathy's death, both the killer and the friend were now certain that no one would ever know that the killer had cheated on the promotional exam that the Air Force called the Weighted Airman Promotion Systems Test, or as everybody called it for short, the WAPS test. The friend who dumped the body was Clint Richards, and the killer was Kathy's soon-to-be ex-husband, Bill Lipscomb. It was Bill, the young master sergeant who had moved up the Air Force ranks with shocking speed, who had cheated on the WAPS test. Kathy knew about it, and she had threatened to expose him during their divorce because she wanted Bill to give her full custody of the children. It would turn out that Marin had been correct in his assessment that Kathy's killer had acted with a plan and had deliberately posed her body. But he had been wrong about why. Bill and Clint had worked together to stage the crime scene to make it look like a murder committed by a sadistic rapist. Those long red hairs were part of that staging, meant to throw the police off, and they had worked even better than either Bill or Clint had expected. And this was because of a chain of events that police themselves had set in motion in their early efforts to identify the body found on the side of the road, when they believed the victim was significantly younger than she was. Police had put the description of the victim out to the media, and a friend of Kathy's had heard it. That friend had been the one to make the identification of Kathy's body, but she only did so after going to Kathy's apartment to check on her. The suspicious red-headed woman the neighbor had seen was actually just Kathy's friend. It was a total coincidence, but it had confused investigators for years. Meanwhile, Bill had escaped suspicion with his alibi because he had told his young children to lie to the police about being with him all night. Bill had preemptively suggested to Marin that Marin should talk to his kids because he knew they would lie for him. It was only when the PI began poking around on the case that Bill's 9-year-old daughter finally found the courage to tell the truth. She had not been with her dad the night her mom was killed. Instead, her dad's friend, Clint Richards, had taken her and her brother out for dinner. That was why, when Kathy arrived at Bill's house right on time to pick up her kids like she always was, she found the house too quiet and realized her kids were not there. When Kathy turned around to confront Bill, he raped and killed her. Clint Richards avoided prosecution for cooperating with authorities. As for Bill Lipscomb, he pled guilty to Kathy's murder in order to avoid the death penalty, and he was sentenced to 60 years in prison. However, he was granted an early release in May of 2021. On a snowy morning in 1972, 22-year-old Sotria Kritsonis sat at her bus stop in Seattle, Washington, adjusting her knit cap against the cold. The hat actually still felt pretty weird on her head because just a few days earlier, she had cut her brown hair super short, and so she wasn't quite used to it yet. But despite that, she loved her new hair. In fact, she couldn't wait to show it off at her school. She'd deliberately worn this big hat to hide her haircut, because this would make the reveal to her friends at school that much better. She glanced up Rainer Avenue for any sign of her bus, but there wasn't one. The city's public transportation system was all out of whack that day because of the weather, and so Tria was becoming pretty impatient because now her bus was over an hour late. She'd already missed her first class of the day because of this bus, and now she was in danger of missing her second class. And that's when she heard the beep of a car horn, and a pale yellow Volkswagen Beetle rolled up to the curb right in front of her. So Tria had to squint through the snow, but she could see the silhouette of a man in the driver's seat of this car, and he was rolling down the window of the passenger side and kind of waving her over. Curious, she walked up to the now open window and leaned in, and the warmth coming from inside the car felt great. And this is where Sotria got her first real look at the driver. He was a good-looking guy in his 20s, he was well-dressed, pleasant-seeming, just an overall normal-looking person. He explained that he'd actually been driving on Rainer Ave for a while and he hadn't seen a bus in a long time, and so he offered to give Sotria a ride to her school. But remember, this is the 1970s, and hitchhiking at the time in America was pretty common, especially on the West Coast where Sotria was. And so pretty quickly, she agreed to get in because she knew this likely was her best chance at making it to school for her second class, and she was freezing. After the man pulled back onto Rainer Avenue, Sotria sat back in the seat, enjoying the warm air blasting out of the vents. And as she did, she looked out her window at the familiar route passing by. Sotria was about to apologize to this guy for making him drive so far out of his way when she heard him turn on his blinker. He was preparing to turn right. And this struck Sotria as odd because, as she had explained to him back on the curb, her school was a straight shot down Rainer Ave. There was no need to turn, so what was he doing? Sotria looked over at the man, expecting him to explain why they were taking this sudden detour, but the man just stared straight ahead. And then a moment later, she heard the blinker turned on again, and she looked up and saw they were about to merge onto Interstate 5 southbound, which was definitely not the way to Sotria's school. And now Sotria felt a pang of fear. She opened her mouth to tell this guy he was going the wrong way, but he cut her off. And he looked at her and he said, "You know, it's a terrible idea to take a ride from a stranger." The man kept on talking as he merged onto the highway, but Sotria was not listening at all. Instead, she was fixated on what he was doing with his right hand. His left hand was on the wheel, but with his right hand, he was fishing for something underneath his seat. And so Sotria's mind began to race. Without taking her eyes off of this man and what he was doing, she traced with her hand and felt for the door handle, but she couldn't feel it. And then she turned and realized there was no door handle. It had been removed. Just then, the man stopped rummaging around underneath his seat. Whatever he was looking for, he had found it. The man sat partway up and looked at Sotria with his hand still hidden behind one of his legs and a determined but emotionless expression on his face. At this point, Sotria felt her heart hammering so hard in her chest that she was worried she might pass out from terror. All she could think about was, what is he hiding behind his leg? What was underneath his seat? But then, something strange happened. The man's face changed from determined and almost cruel to confused. Sotria watched as his eyes darted up to the top of her head. The man told Sotria to take off her hat, and with trembling hands, she did as she was instructed, although she had no idea why he was asking. And when the hat was off her head, the man looked shocked, and he dropped whatever it was he had found back under his seat, and Sotria heard it land with a heavy metallic thud, but she couldn't see it. There was a long, tense silence, and then when the man finally spoke, he just said, "Why did you cut your hair?" The man immediately got off the highway and drove fast to Sotria's school. When they got there, he opened up the door for her and told Sotria to get out and said she was lucky. Then he drove away. Sotria didn't report this encounter to police. She was kind of embarrassed that she had gotten into a stranger's car in the first place, and after all, the guy, despite being really creepy, hadn't hurt her at all, and so she basically just tried to forget about it. But a few years later, in 1975, Sotria was watching TV when she saw a familiar face come onto the screen. It was the man who had given her a ride, being led into a courtroom in handcuffs. Sotria dropped everything and turned up the volume, and what she heard made her numb with horror. Because the newscaster was saying that this man who had given her a ride was a suspected serial killer accused of murdering dozens of young women who he would lure into his pale yellow Volkswagen Beetle and then bludgeon them to death with a crowbar or tire iron. And he had a very specific type when it came to identifying his victims. They were young women who all had long brown hair. And this man's name was Ted Bundy. Our next story is called The Box. Late one afternoon in April of 2019, A middle-aged woman named Mary was cutting up some vegetables in her kitchen in northern Spain when she heard a knock on her front door. So she put her things down, she went to the door, opened it up, and standing there was her next-door neighbor, who was all smiles, and she was holding this big box that was wrapped in wrapping paper and had a big bow on it, and then sitting on top of this big gift was a tray of deep-fried rolls, or croquettes. Mary's neighbor was a 61-year-old woman named Carmen Marino, who was an exceptional chef, and her specialty were making these croquettes. They were filled with different types of meat and other things, and all the time, Carmen would come over and give them to Mary, and Mary loved these croquettes. And so as soon as she saw those, she was like, wow, amazing, and she invited Carmen inside. But Carmen didn't come inside. Instead, she took the croquettes and handed them to Mary, and Mary's like, okay, great, thank you. But Carmen was still standing right outside holding this box, and now Mary's looking at her thinking that Carmen looks kind of uneasy. And so Mary said, what's going on here? What's up with this box? Carmen was silent for a second and just kind of held this box out, at which point Mary realized, okay, so she's trying to give me this gift. And so Mary reached out and took this huge present, and she was like, thank you, Carmen. Like, what is this? What's going on? And Mary, when she looked at Carmen, she could tell Carmen's face was now bright red. She was very embarrassed about something, maybe whatever she was going to say, and so Mary just waited for Carmen to speak. And so eventually she would clear her voice, and then she would say, Mary, this is really embarrassing, but I need you to hold on to this box for a little bit. It contains my sex toys, and I'm having company over at my house, and I'm just worried that somehow they're going to find these things. Mary was so caught off guard by what Carmen was telling her that she just started laughing. But Carmen didn't join in on the laughter. She just kind of looked down like she was totally mortified. Mary stopped laughing because she felt bad, and then Carmen kind of elaborated on why she had this huge box full of sex toys. She would tell Mary that, she bought them with the intent of using them with her boyfriend, but a couple of months ago he had broken up with her. But Carmen had held on to these in the hopes that the boyfriend would eventually take her back and they would get back together again and get to use these toys. And so even though this was a totally weird and kind of uncomfortable request, Mary kind of felt bad for Carmen. One, because she had to make this request of Mary, but also two, it was obvious that Carmen was pretty shaken up about, losing her boyfriend. And so Mary said, you know what? No problem, Carmen. I will look after your sex toys and I will enjoy your croquettes. And Carmen was so relieved and said, thank you so much. And then she turned and hustled back to her house. And then Mary shut the door and she brought the croquettes into the kitchen and she tried one and it was so good. And then she took the big box of sex toys and she went into the hallway. She opened up a closet and she put it on the top shelf and then shut the door. Over the next couple of days, Mary expected Carmen to come back over and reclaim her box of sex toys. But Carmen didn't. And when days turned into weeks and then turned into months, and still Carmen had not come over to get the sex toys, Mary was kind of annoyed, but she was just too embarrassed to go over to Carmen and be like, hey, why don't you come over and get your sex toys? And so Mary just decided she would leave it alone and not talk about it, and if ever Carmen wanted them back, she could have them. But if she never asked for them again, Mary didn't care. She would just eventually throw the box away, and that would be it. A few months later, on September 29th, 2019, so we're talking about 6 months or so from when the sex toys were first brought over to Mary's house. Well, on this day, Mary was kind of doing chores in her house when she began to smell a really bad smell coming from the hallway closet where the box of sex toys were. And so Mary opened up the closet, and for sure, she could tell the bad smell was coming from this closet. And so she started by smelling the shoes that were towards the bottom of the closet to see if maybe she had stepped in something gross, but they were all clean. And then eventually she reached the sex toy box. She pulled it down from the top shelf, and it had never been opened. It's still wrapped, but she just smelled the box and she immediately recoiled because that had to be where the terrible smell was coming from. It was coming from this box. And so Mary was totally repulsed at the idea that these sex toys smell horrible, but she carried the box into the kitchen and set it down, and she thought, is this a horrible betrayal of my friend's trust if I open up this box and look at her sex toys? But Mary ultimately was like, you know what? Carmen has not come back for this thing. I'm opening this up because I need to know what's making this smell. So Mary went over and got a pair of scissors and she cut off the wrapping paper, and then she opened up the box And inside was like this big thing that had been wrapped in tinfoil, so all you saw was tinfoil. And so Mary, she reached down and kind of began to peel back the tinfoil. It was kind of sticking to whatever was under it. But eventually, after she kind of yanked on it, she pulled the tinfoil off. And when she saw what was in there, she began screaming and ran outside and called the police. It would turn out Mary's neighbor, Carmen, who owned the box of sex toys, well, her boyfriend didn't just break up with her a couple of months before she brought the sex toys over. No, her boyfriend, who was a 67-year-old man named Jesus Baranda, he went missing around the time that supposedly Carmen and her boyfriend broke up. And so naturally, Jesus's family began looking for Jesus, and when they couldn't find him, they called the police. And eventually the police called Carmen and said, hey, you were dating Jesus around the time he went missing. We're going to need to come to your house and search it. And when Carmen heard that, she knew she had a big problem. Because Carmen had murdered Jesus and cut his head off with a chainsaw, and she still had his head in her house. And so what did she do? Well, she boiled his head down, and then she put it in a box, wrapped it in tinfoil, and then she wrapped that box in wrapping paper, put a bow on it, and then went next door to Mary's house and said, hey, can you hold my sex toys for me? Because she knew Mary would likely not look in the box if it was sex toys. And so Mary took the box, put it in her closet, and then of course, the smell began several months later, and she would discover Jesus's head. Carmen was convicted of murdering her boyfriend, and she was sentenced to 15 years in prison. Police were never able to locate the rest of Jesus. All they had was his head. But there's a running theory that Carmen may have used the rest of her boyfriend's body and ground it up and then baked him into her croquettes that she gave out to people like Mary and other people in her neighborhood. But that's just a theory. The next and final story of today's episode is called, What's That Smell? On the evening of June 7th, 2023, a 36-year-old man named Umar Abdullah walked into his bedroom in Tampa Bay, Florida, and right away he opened up all the windows. Now, keep in mind, Tampa Bay, Florida is really hot. And so by doing this, he was letting in all this really hot air, but Umar did not care. He just wanted whatever was inside of his apartment out. Umar, along with his wife Samira and their 10-month-old daughter, had just gotten back to their apartment after a trip to Ohio, and the second they walked inside, they had smelled this weird smell. And it was something they had never smelled before. This was not like rotten food or anything like that. This was like a chemical smell. But even that wasn't a good description. It was like a cross between chemicals and maybe paint. And so at first, Umar and Samira just walked around their apartment, predominantly in the kitchen, looking for things that could be leaking, in the fridge or in cupboards or whatever, but they couldn't find anything that seemed like it could be the cause of the smell. And it was around this point, when they were totally stumped, that Umar and Samira remembered that their apartment building was extremely well taken care of. Like, repairs were done immediately and all the time in every single unit, and the fact that they had been away in Ohio had been known to their apartment manager, and so they thought, maybe while they were gone, maybe somebody had come in here and maybe touched up some paint or made some repairs or something, even though it seemed a bit weird that they hadn't been informed beforehand that, painting or repairs were going to take place in their apartment, but ultimately that's what they chalked it up to. And so it was at this point that Umar and Samira walked all around the apartment, opening up all the windows, and Samira also lit a candle as well, and pretty soon that weird smell disappeared, and both the parents just kind of forgot about it. And so Umar grabbed all their luggage from their trip and began unpacking it into the drawers and putting toiletries away, and at the same time, Samira put their baby in a high chair in the kitchen, and then Samira began preparing dinner. And a few minutes later, as Umar was still putting things away, he heard Samira calling from the kitchen to, hey, come out here for a second. And so Umar stopped what he was doing, he went into the kitchen, and he looked at Samira, and she was looking very concerned down at their daughter. And their daughter was in her high chair, and her dinner was right in front of her, but she wasn't eating. And their daughter seemed really fussy. And normally, their daughter was such a get-along kid who never fussed, who always ate her food, and so this seemed really out of character.
And so both parents kind of stared at the daughter for a second, and then Umar was like, you know what, all the windows are still open and it's getting pretty hot in here. Maybe the baby's just fussy about the heat. And so Samira agreed that could totally be it. And so the parents went around the apartment, closing down all the windows, allowing the air conditioning to kick back on and cool the apartment down. But about an hour later, after the apartment had cooled back down, the baby was still very fussy. And at this point, Umar and Samira were trying to put the baby to bed, and they were really struggling with that. And also, in addition to the baby obviously not feeling very well, Umar and Samira both began to complain that they had headaches. And so at this point, the parents assumed that, you know what, all of this, the baby's behavior and now our headaches must be tied to just the travel we just went through, and we just need a day to recover here. And so they kind of rushed their baby through her bedtime routine and eventually got her down. And then Umar and Samira took some ibuprofen to help with their headaches. And then they too climbed in bed and drifted off to sleep, hoping that when they woke up, everybody would feel better again. But the next morning, nobody was better. In fact, everybody was doing worse. Umar's headache had now gotten much stronger, and Samira, she still had a headache, but also was very lethargic, and the baby was still very fussy. And over the next few days, their symptoms continued to get worse and worse. Umar's headache went from really bad to pretty much blinding, like he couldn't do anything else but think about his headache. And Samira basically had to lay down all day. It was like no matter how much she slept, she had zero energy, and their poor baby just continued to cry and fuss all the time, and even began to vomit. And so it seemed pretty obvious by this point, after a few days, that the three of them must have caught some sort of bug while they were traveling, that this was not just jet lag, that they actually had some sort of illness. But the parents were convinced that, they could just kind of rough it out, and eventually, after a couple of days, they would get better. But on the morning of June 14th, so this is now a week after coming back home from their trip, not only were all their symptoms still really bad, but on this particular morning, things took a dark turn. That morning, when Umar went to his daughter's bedroom, he's still dealing with this horrible headache. He makes his way into the bedroom and he goes down to pick his daughter up from her crib. And as he's reaching down to grab her, he freezes because on the bed, on the pillow right behind the baby, is all the baby's hair. The baby had clearly lost huge chunks of her hair. And so Umar at this point forgot about his headache and yelled for Samira. And even though she's super lethargic, she could tell this is an emergency. So she got up and made her way into the bedroom, and she looked down too and saw all the hair, and she reached down and scooped the baby up, and she turned the baby over. And sure enough, there was a huge bald spot on the back of their baby's head. But Umar and Samira, they said to each other right away that, wait a minute, I know this is scary, but it is actually a thing that newborn babies sometimes do lose their hair. But when they went online and looked at the age range of when that's kind of a common thing to happen, it was pretty obvious that their baby, being 10 months old, was a little bit too old for losing her hair to be considered a normal thing. And so Umar and Samira sat there and continued Googling, what could this be? My 10-month-old baby is losing her hair. And there were lots of explanations ranging from, ringworm to some severe infection to some rare genetic disorder. And all of it was kind of terrifying, and also none of it really lined up with what they were seeing with their daughter. And so the parents were like, you know what? Clearly, we don't know what this is. We've all been sick for a week. We have to bring our baby to the doctor. And so as Samira got on the phone and called the baby's doctor, Umar hopped in the shower to get ready to go to the doctor. And as soon as he began shampooing his hair, he noticed clumps of his hair were falling out. And so all of a sudden, it dawned on him that whatever's going on with his baby is going on with him, and very likely going on with his wife too. And it was at this point too that Umar remembered that strange smell when they first walked into their apartment after coming back from their trip. Now, they had opened up all the windows and lit candles, and, the smell had kind of dissipated, and then they had shut the windows again, and they hadn't smelled it again. And so Umar began thinking, wait a minute, maybe we've just gone nose blind to the smell, and maybe there's some sort of contamination in the air. Maybe there's a gas leak or something worse than that. And so as soon as Umar got out of the shower and told his wife about how he lost hair and kind of his theory that maybe there was some contamination in their apartment, Umar called his landlord and explained, the whole situation. And the landlord would tell Umar right off the top that, during the time they were in Ohio, nobody went inside their apartment. So there's no fresh paint in there, no maintenance was done. So whatever you smelled was not from us. And then the landlord said to Umar that, you know what, as scary as it sounds, it's possible that you might have like a gas leak inside of your apartment, or maybe you have a freon leak from your air conditioning system, or maybe there's toxic mold. But whatever it is, we're going to get people in there, we're going to find the issue and solve it. And so later that day, sure enough, a gas inspector showed up to Umar and Samira's apartment, and they checked the entire place, and they could not find any trace of a gas leak. They checked everywhere. There was no leak, but they did tell Umar and Samira that yes, we can smell a faint trace of some chemical smell, but we don't think it's gas. And then after the gas inspector left, the landlord went out and found a mold inspector who came into Umar and Samira's apartment. They looked everywhere and could not find any mold. Then the landlord brought in a plumber to check the hot water heater, but no issues with that. Then the landlord brought an HVAC company in, and they checked the air conditioning units, and there was no leak. And so finally, after the landlord had kind of run out of ideas for who to bring over to check the apartment, because again, by this point, nobody had found anything wrong with the apartment, Umar just said, you know what, I'm going to call the fire department. And so Umar, he calls the fire department, and the fire department, they send over their hazardous materials team or their hazmat team. And so they go into the apartment and they look everywhere, and there is nothing. They could not find any source that was causing the smell at all. It seemed very much like their apartment was totally safe and fine. But by this point, it's now been 2 weeks since Umar, Samira, and their baby had come back from that trip, and they still felt totally horrible. Umar still had his headaches, he was still losing his hair. Samira had begun losing her hair as well. She still had her headaches, she still felt lethargic, and their baby was still losing her hair, and she still was fussy and miserable. And all three of them now had developed this weird shortness of breath where they'd just be walking through the apartment and suddenly it was like they couldn't even breathe. And so now they've had all these people who can't find anything wrong with their apartment. They'd gone to their doctors and the doctors had no idea what was wrong with them. And so it was kind of like they had no idea what to do, but clearly this crisis was only getting worse and worse and worse. And so Umar felt like he had no more options. He couldn't leave his apartment. He couldn't afford to do that. And so they were just stuck in this place that seemed toxic. But all that would change on June 25th, so 2.5 weeks after they came home from that trip, because on this day, Umar discovered something about that chemical smell they caught right when they came back in after the trip. You know, the smell that all the people that had come into the apartment had sort of noticed but couldn't identify. On June 25th, Umar figured something out about that smell. And so on this day, Umar was in his apartment feeling completely miserable, as was his wife and his daughter who were in the bedroom. But at some point, Umar suddenly caught a whiff of that weird chemical smell. And as soon as he smelled it, he sort of began to cough, and he was about to call his landlord and be like, hey, I smelled it again. But he decided on this day, instead of calling anybody else, he was going to run an experiment of his own. And so instead of trying to get away from the smell, Umar began smelling in the air as deep as he could to try to kind of figure out where the smell was coming from. And so he began walking around his apartment, sniffing the air, kind of tracing the smell, and slowly but surely he began kind of following the smell through his kitchen, down the hallway, all the way to his front door. And when he got to his front door, he smelled in again, and he could tell the smell was the strongest right now. And so feeling a sudden jolt of adrenaline, he grabbed the door, flung it open, half expecting to see like a chemical cloud floating in the air in the hallway. But as soon as he opened the door, there was nothing outside. And when he smelled in the hallway, the smell wasn't really there anymore. And so he kind of looked around for a second, feeling kind of silly, and then he shut the door, and he was about to just go back into his apartment and just kind of accept that once again, I got no idea what's going on here. But then he stopped, and he turned back around and looked at the actual door, like the actual front door of his apartment. And he began smelling the door, and the door definitely had the chemical smell. And so he began smelling and tracing his hands all over this door, not even sure what he was looking for, but eventually he worked his way all the way to the bottom of the door, and that's when he felt something. And so suddenly Umar got down and stared at this strange thing he had found on his door, and as soon as he saw what it was, he jumped up and ran to his wife to tell her what he had just found. After talking with his wife about this thing, they came up with a plan. Late that night, Umar waited until the entire apartment complex seemed really quiet, and then as quietly as he could, he opened up that front door, he stepped out into the hallway, And then he made his way over to the big fake plant that stood at the end of this hallway that was kind of right outside, kind of adjacent to his door, and he hid something in the plant. And then Umar went back into his apartment and he shut the door. And on June 27th, so 2 days later, the moment Umar and Samira had been waiting for finally arrived. At around 5:30 p.m. that evening, suddenly that chemical smell began to emanate through the apartment, and their baby began coughing so badly she began vomiting. And so as Samira was tending to their baby, Umar very quietly opened up his front door, looked in the hallway, didn't see anyone, and he rushed over to that plant, and he took the thing he had hidden a couple of days before, and he went back into his apartment, shut the door, and went into his office. And when Umar came out of that office a little while later, Samira was waiting, and she was looking at him, and as Umar came out, it was like he was totally ashen-faced, he looked completely shocked, and he could barely speak. And Samira said, "What's going on? What did you learn?" And Umar said, "We have to get out of here right now. Get the baby. We have to leave right now. We're going to the hospital." And so as Samira bundled up their baby and they started getting their things together, Umar called 911 and told the operator what he had just discovered. The strange thing Umar had discovered on his front door 2 days earlier on June 25th was a weird crack at the very base of his door where you could basically see from inside of his apartment out into the hallway. And the thing Umar and his wife had decided to hide in the hallway in that plant was a video camera aimed at their front door, because they were suspicious that something was making its way through that crack in the door into their apartment, and they wanted to catch it on camera. And that's exactly what happened 2 days later when around 5:30 p.m., their daughter began coughing and Umar began to smell that smell in the apartment, and he rushed out, he got his camera, he went back into his office, he watched the footage, and he could not believe what his camera had recorded. Just before 5:30 p.m. on June 25th, so right before the smell came into the apartment, on video, you see this guy walk up the stairs and enter the hallway right in front of Umar and Samira's apartment door. And this man had a syringe in his hand, and he knelt down and he placed the syringe into that crack at the bottom of Umar and Samira's door, and he pushed the plunger of the syringe before pulling the syringe out, quickly turning and disappearing down the stairs. And so as Umar and Samira and their baby rushed to the hospital after discovering this video and after calling 911 to tell police what they saw on this video, the police rushed to Umar and Samira's apartment complex. Not to go to Umar and Samira's apartment though, instead to go to the apartment right below Umar and Samira. The man who rented that apartment right below them was a 36-year-old named Zuming Lee. He was a married father of two who was working on his PhD in chemistry from the University of South Florida, and Umar and Samira thought of him as being a really nice guy. He was very quiet, he kept to himself, he even gave them a gift after their daughter was born. But on this evening, when the police arrived at Zuming's apartment and knocked on the door, when Zuming opened it up, he was immediately arrested. It would turn out, despite Zuming giving Umar and Samira that gift after their baby was born, well, that was the end of him liking Umar and Samira. Because as soon as they came home with their baby, Zuming became obsessed with how noisy their baby was. Even if their baby was barely being loud, it completely consumed Zuming's mind. It was like he was obsessed with listening for this baby. And then suddenly it wasn't just the baby that annoyed him, it was even the slightest noise he heard above him coming from Umar and Samira's apartment that totally sent him into a rage. And so Zuming began constantly going to the homeowners association to complain about the baby and, the toilet sounds and the footsteps he was hearing. And when that wasn't enough, he began going to the police about it. Now, Umar and Samira had been told that their downstairs neighbor really was upset with how loud they were being, and so they did everything they could to be quiet. They felt so bad that they were coming off as being these very loud and disrespectful people, which they were not. They did have a little baby, and babies make noise, but they were doing everything they could to be quiet. And so they had no idea that Zuming was still just completely furious at them. And eventually, Zuming's fury just became completely unhinged, and he used his chemistry know-how, because remember, he's studying for his PhD in chemistry, to begin putting together this deadly mixture of chemicals that contained things like methadone and hydrocodone, and he put them into a syringe and he began injecting them into Umar and Samira's apartment to poison them to make them be quiet. And so by the time Zhu Ming was arrested, he had been injecting these deadly chemicals into their apartment for a month. That was obviously the cause of all of Umar and Samira and their baby's symptoms. It was this poison. Umar, Samira, and their baby would get treatment and they would fully recover from their poisoning, but very likely, had they not been quick thinkers and put that camera in place and caught Zhu Ming in the act, it's entirely possible that over time, the poison that was being injected into their apartment would have killed them. Officials are still investigating this case as it's still relatively new. However, the legal process was paused when Zhu Ming was deported back to China. Zhu Ming has not been convicted of any crime, and the criminal case remains open, and if Zhu Ming ever were to step foot on US soil, he would be arrested immediately.
A quick note about our stories. They are all based on true events, but we sometimes use pseudonyms to protect the people involved, and some details are fictionalized for dramatic purposes. Thank you for listening to the MrBallen's podcast. If you enjoyed today's stories and you're looking for more bone-chilling content, be sure to check out all of our studio's podcasts. There's this one, of course, the MrBallen's podcast, and there's MrBallen's Medical Mysteries, Bedtime Stories, Wartime Stories, Runful, Redacted, and Late Nights with Nexpo. All you have to do is search for Ballen Studios wherever you get your podcasts. To watch hundreds more stories,